All right, let's bring in our guests. We have in the studio Dr. Abiodun Oguni. He is the Assistant Director and an epidemiologist, I beg your pardon, and Head Health Emergency Preparedness with Nigeria Center for Disease Control. Thank you for joining us.
Thank you very much. It's good to be here this evening.
I want to believe it's not been easy for the NCDC, tackling this consistent outbreak of cholera. But you would tell us how is the agency dealing with the burden so far across the country?
Thank you very much, Ruth, for the question. So for perspective with respect to the current burden of the disease, we have reported, since the last report that was provided, we've had now about 566 persons lost to this outbreak. Then the number of cases reported is also close to 15,000 cases. And I could recall with some nostalgia when this response started around June 13. We gave out some of these advisories to let the country across the state and individual understand the fact that we had just starting then because we knew that the rains were not really here as at that period. And as rightly predicted by NIMET and NISA, that's Nigerian Hydrological Services Agencies, made us realize that we are going to have unusual increase in the amount of rainfall this year. We have all been witnesses to this. The implication of this is with the rise in water levels, there's possible reasons to have more runoffs on the sewage system, which gets to contaminate our water sources. Thereby, the water that is contaminated gets to contaminate the food used for such, for cooking, using such water that is contaminated. And this challenge continues in that regard. So as we speak, the burden of the disease has actually doubled what we had last year, both in number of cases and the number of those who have died, that we have lost to this disease. What does this imply? The implication of this for us as a country is not that we did not prepare, it's not that we did not put in effort, it's just that it wasn't enough to have been able to really avert this situation because of the effect of what climate change is also bringing to us, which we don't have control over. And what does this mean? With this flood that is happening, with increased global warming, the weather changes, it is anticipated that the risk of transmission of this infectious agent will be higher than it used to be. And so what is expected of us is the strategies to be able to put in place. Unfortunately, this is a disease that affects very vulnerable groups. The children, especially less than 15 years of age, are the worst affected. Yeah. And we have also seen, I can see from the report earlier presented, that it's not just, it is no longer 35 out of 36 states. Now all the states in Nigeria, including Enugu State,
are contending with it.
Are now contending with the disease.
And it's quite, it's a burden for most states, especially when they don't have the capacity for surveillance and effective response to this disease, which is the task responsible, which is the task rather for the NCDC. How is the NCDC upscaling that surveillance mechanism, to help states respond effectively? Thank
you so much. So this speaks to the global strategy that was put together by the Global Task Force for Cholera Control, which the country adopted and aligned our response strategy to this response. The Global Task Force on Cholera Control has a focus, which is to eliminate cholera in 20 countries at least by year 2030, and to reduce mortality due to cholera by 90% by year 2030. And so in our efforts, there are three-pronged approach in getting this done as adopted globally, which we have also adopted. And the first speaks about targeted prevention. As we all know, we say prevention is not only better, it's also cheaper than cure. So there are interventions that are expected to be done. We call it priority area for multi-sectoral interventions, this which we initially called the hotspot. So there are LGAs. If you look at the statistics being reeled out, you find that 10 out of our 36 states contribute about 85% of the burden of this disease. And of all our 774 local government areas, I think about 15 of them are responsible for close to 60% of the cases. So what does this speak to us? We are moving on to be able to really redefine and review our priority areas for multi-sectoral intervention that we call the hotspot for these diseases. This will help us to have targeted prevention intervention with areas of improved water supply, sanitation, and hygiene, and improve the advocacy, community engagement, and all that we need to do to be able to prevent this disease from happening in those areas. The whole idea is that if you're able to invest in those areas, maximize your interventions, you're able to really cut down drastically the burden of this disease in this regard. That's about prevention. The second speaks to the strategy around early detection and prompt response. By early detection, what does this speak to? By early detection, we are looking at the surveillance system, like you rightly said, that could really help us to promptly detect these cases as they occur in the community. So we're building the capacity of our disease surveillance and notification officers around the country. We've been doing these over the years anyway. And before I go into that, before every outbreak and at the end of every outbreak, there are reviews that are done, risk assessment that are done. And for this particular season, we have already kind of done assessments that will help us understand where the burdens are. We have a seasonal calendar that gives us the picture. So we already know that this may be happening in this period, just that we may not be able to get
Which
exact.
brings us to the aspect of preparedness.
Yeah.
Earlier you said it's not like the agency wasn't prepared, but we get to see situations like this, happen, especially when there's an outbreak. That's when we get to see that response. I'll help you ponder on that thought because I want you to ponder on that thought rather. I won't help you. Let's go on a break. We'll be back so you respond to that. Stay tuned. Thank you for staying with us. Dr. Oguni, just before you respond to what I'm going to ask you, let's check out the numbers, with Enugu State. We're hearing 10 deaths recorded in the state due to the cholera outbreak, and the state government has called for emergency response by health practitioners. Well, all the sister health agencies are collaborating with the Ministry of Health in their efforts to de-escalate the spread. Following NCDC guidelines, Chiagonu Aro reports.
In line with the Nigeria Center for Disease Control guidelines, personal hygiene and environmental handling have been harped on, such as a regular proper hand washing, use of clean water, safe food environment, among others.
To make sure that we observe strict preventive measures that will not allow us to put into our mouth contaminated things. For instance, how do we wash our hands before we touch food items, that anything that's going into our mouth? We have to apply adequate hand washing so that from work, from farm, from anywhere, you wash your hand very well with soap and water.
Taking a One Health approach in Imo State, where we are involving other ministries, such as the Ministry of Environment and Sanitation, the Ministry of Water Resources, Ministry of Education, Ministry of Information, and also the Ministry of Agriculture in the One Health approach.
With the control measures put in place by individuals and the health sector, the spread of cholera will be contained. In Enugu, Chiagonu Aro, NTA News.
All right, let's continue the discuss, Dr. Oguni. If I caught you correctly, earlier you said the agency has a time frame and knows when this outbreak, which is seasonal, right?
Very
you
correct.
stated that. So I was going to ask you about the preparedness. Why do we have to wait until there's an outbreak before we see response happen? Is it that the capacity is a challenge? You tell us.
Thank you very much. So this is a question that begs for answer, absolutely, because this is what we have also been advocating for, that collectively we need not wait for that knee-jerk reaction when outbreaks occur. We have the good opportunity before the outbreaks to put the measures in place. And for us at the NCDC, what are the things we prioritize? We ensure that before the outbreak occurs, we preposition, that's like stockpiling, necessary consumables for treatment, for diagnosis with the rapid diagnostic test kit in all our states, and this can be verified. Now, we have this deployed to them, and the whole idea is to ensure that we can promptly detect the cases when they occur. We have a digital application for surveillance tools that we deploy that we call SUMMERS, which is helping us to detect the cases and report them as real time as possible. So with this put in place, we expect that when the cases report, we detect, we have laboratory capacity in the state, but for states that have lesser capacity, they have the opportunity of transporting their sample to the NCDC laboratories where they can be easily detected. Now, if with these structures in place, it's expected that we shouldn't be caught unawares when this happens. We've trained the capacity, we'll build the capacity of our healthcare workers, the surveillance officers. We have risk communication and community engagement approach, which is evidence-based. We're using data through our regular surveys, polling, to get data that will help us provide more specific and targeted interventions that is tailored to the community needs, using the all-of-society approach, a bottom-up approach, wherein the community members have a greater contribution in determining how we respond to the outbreak. So all of these things happen. But unfortunately, there are no adequate attention, especially when you give out advisories to states or to the other relevant stakeholders, to the general public. And we also found out that most of the times, as soon as the outbreak season is over, everybody just goes to the rest mode, as if we are now out of the hood. So one of the call to actions we are making is that please, even, including our colleagues in the media, please let's not stop the conversation when the outbreak season is over. It is meant to be around the year, not only for cholera, for all of the disease conditions that we are prioritizing.
Yeah, because personal and environmental sanitation, of course, it's very crucial. And I recall that the NCDC is leading a multi-sectoral national cholera technical working group
I'm going to come to that.
with other agencies. So what is the response? What is the synergy like? What are you getting, the kind of support?
So the component of the strategy that speaks to response is being able to set up and institute what we call the Emergency Operations Center. We have in all our 36 states in the country functional emergency operations centers activated, wherein they can coordinate all through the sector using the One Net approach, environment, agri, Ministry of Information, the Primary Healthcare Board for vaccine-related interventions, because vaccination is also a component for the prevention. So all of these are being put together. And for us at the national level, we have similar approach, including contributions from our partners who are working with us. So this is in line with the third strategy of the Global Task Force, the roadmap, which brings in the issue of coordination, collaboration, to ensure that we have the relevant resource mobilization, we have the relevant technical expertise that could help us provide guidance and build the capacity of the people to be able to respond appropriately. This is in place, but it is not adequate yet, because the issue of cholera outbreak that we are experiencing is beyond health. It is issues related to making available adequate water supply to the community. Yeah. It is how do we end open defecation. As long as open defecation exists, we are going to keep having this challenge. Even though the climatic conditions that we don't have control over, we are also working on how to build resilience, a climate health resilience systems.
Among
and that
communities.
is the conversation among the community, such that we are better equipped. And that is one of the things our community engagement strategies is helping us. So we're having this focused intervention to ensure that people are better prepared and they are equipped ahead of the next outbreak. One thing we are committed to is that Nigeria should be one of the 20 countries that will be able to eliminate cholera by year 2030, as put on the map.
Well, Dr. Ogunni, 2030 is around the corner. And
yes,
people
it is
are
achievable.
dying
Yeah, it is achievable.
from this disease. My question is, I'm glad you mentioned building resilience among communities, which takes us to community engagement beyond when the outbreak is at its peak. Is the agency engaging communities at the grassroots, teaching them, sensitizing them rather on the needful?
And that was what I mentioned earlier on about our health promotion officers. We have across the 36 states and 774 local governments.
But are they reaching out is the question.
They are, and that is, we have evidences, and that is where we are getting the data that is informing development of messages that are context-specific to the needs of the people in that community. But we are saying that beyond the messages, beyond the awareness, if you ask me not to defecate openly and there are no toilets made available, if you ask me to drink clean water and the only available water around me is the stream water that is flowing, and that is where we are saying the other component that could help make this efforts get the expected result is to address those developmental challenges, is to address those issues relating to provision of adequate water for the people, especially in those high burden or hotspot areas where these cholera cases are high, and we know them. It is to ensure that we can make more toilets available for the people, such that we discourage the open defecation habit. As long as we are able to work on the people to be able to adopt better hygiene, as basic as hand washing with soap and water as expected, especially when they use the toilet. These are basic things that people possibly feel it doesn't matter. But if we can really address them, we are very confident, because one thing is this: cholera is being transmitted from the feces that is contaminated our food and water sources. And human being is the only known living host of this organism. So if we can deal with it in human host and we don't get it shared into the environment, you don't get it transmitted to other people, we are very confident that with the collective effort of everybody, we can stop the transmission of this agent, this organism that is causing it, and we can help cholera.
Especially, Dr. Oguni, when there is funding to meet these targeted requirements that you're saying. You're not mentioning them directly, but of course we know they're there. Every state or community has its own peculiar challenge, but it still ties around this environmental challenge of the open defecation and poor sanitation we get to see. Now, is the agency, based on the technical working group, is the agency getting international support? We know WHO is part of it. What kind of support is the agency getting? And what is the body language of other sectors you're working with towards addressing this? Yeah,
so like I said, the Global Task Force on Cholera Control also, after the 2018 that they set up, they launched the roadmap. In 2020, there is a country support platform globally that is coordinating effort, and we have it in Nigeria. We have the International Federation of Red Cross Society that is fully on ground as a country support platform, helping to galvanize efforts of other stakeholders. And like I mentioned earlier on, whenever we establish or activate our incident management system operating at the emergency operation centers, all partners, is it UNICEF, WHO, Breakthrough Action Nigeria, a long list, let me not, for the want of time. So we have these partners. But the concern we are putting forward now is that let us take it beyond just waiting for response, which most of the resources are made available. Let us make efforts in place, put efforts in place at the preparedness phase. Let's invest more in preventing this outbreak before they even ever occurs. With that, we are able to reduce the burden. In our approach, we have the case management options, which we support states to be able to set up cholera treatment centers. We support them to set up oral rehydration points, whereby patients or cases of this disease can easily get treatment. And we all know that cholera death occurs when the patient is losing fluid rapidly. And if you don't get immediate attention, one of the major causes that we have seen, and that is why we are advocating for people to report early, is that people present late to health facilities. They keep doing self-medication, which we are discouraging. Please, if you are losing water, you are losing fluid in your system, it is not to go and be buying over-the-counter drugs. It is to quickly get to health facilities where you can be treated. So in a nutshell, we are appealing to Nigerians. For us, we are committed to protecting the health of Nigerians, but it's an all-of-society approach. We need all of our effort to be able to stop this menace, and we need to make it sustainable, and we believe it is possible and is achievable.
In a nutshell, personal hygiene should be top priority. Thank you very much, Dr. Abiodun Oguni. He's the Assistant Director and Epidemiologist, Head Health Emergency Preparedness with the Nigerian Center for Disease Control. Thank you for your time on Weekend File.
Thank you very much for having me.
You're welcome.
And thank you for all you do.
All right.